We're live now, and welcome, Professor Dr. James McDonald. Probably many of you have heard about him because Dr. Jim was here in another um, Anthropublic discussion webinar. So we're really glad to get Dr. James McDonald back here. Welcome, Jim. How are
Oh,
you?
hey, it's great to be back.
Thank you, thank you. So, we're having this Ramadan here in this part of the world. I mean, it's all over the world, but
Right?
Bangladesh is a Muslim country predominantly. So we're just had God broke the fast, and now we're
Yeah.
having a little discussion with you with about Paul Farmer. You see, he died in 21st of February this year, 2022, and he's a big name, not only in public health but also in medical anthropology, as you probably agree.
Oh,
And
absolutely. Yeah.
dear audience, by the way, probably many of you know that Dr. James McDonald is a professor of the University of Montevallo, Alabama, USA, and he was a former dean of humanities and social sciences in Southern Utah University, and associate vice provost of the University of Texas at San Antonio, USA. So we're really glad, and also Professor James McDonald is deeply associated with this Society of Applied Anthropology, which is one of the biggest body of the applied anthropologists around the globe. So he was this for example, he was one of the big organizer of this year's SFA conference. So James is one of the most important and relevant person to talk about Paul Farmer. So, Jimmy, what can we just start from your association with Paul Farmer? How, when did you meet? Did you meet him in your path of career or your work?
Yeah, I met him in passing at the American Anthropological Association meetings, but I didn't particularly know him. He works in medical anthropology, and I'm much more into rural development work. So we didn't cross paths very often, but of course, everybody knows about Paul Farmer, right? And the great humanitarian activism that he's carried out over a good portion of his lifetime. And I think we're all in awe over what he was able to accomplish and his vision for, a more humane and healthy and happy world, right? I mean, I saw a great quote somewhere that said he wanted the whole world to be his patient, right?
Yeah.
And
He was a great humanitarian. I mean,
yeah,
he was once he was told as the great advocate for the world
yes,
to cure the
yes,
world. So and one of the books written after him is Mountains Beyond Mountains, and where he was called as the person who will cure the world. So, but unfortunately, he was only 62
I know. It's just shocking,
when he
isn't it?
died. Yeah, he was in Rwanda in his own hospital, and he died. So we'll talk more into his life and work. I mean, how he was, according to you, what is his motivation? How is he was a Harvard professor and was a medical doctor and then turned into
Yeah.
a medical anthropologist. And what what is your understanding about his motivation of being a champion of applied medical anthropology? He did so many things for the poor of the poor section of the people of the world.
Well, that's a great question, and it's always sort of hard to get at people's intent. But obviously, he was a deep humanist. His interests varied widely, right? And now think about this for a minute. I mean, he's remained a practicing medical doctor his entire life, right?
Yeah.
And ran a massive NGO, public health NGO that had,
Partners in Health.
yes,
Partners
Partners in Health, that had a global reach. He, is busy fundraising. He's still doing research. They're building, medical infrastructure. I mean, I don't know how this guy found any time to sleep, frankly. I mean, he must have been just a remarkable guy, and incredibly highly motivated to get as much done as he could, as quickly as he could, to literally save the world, right?
Yeah.
And I don't know if you've looked at it, but I was listening to a podcast the other day where they were talking with an architectural design group called Mass, after Massachusetts, Mass, and that ended up connecting with him. They were just students at wherever they were, MIT or Harvard, and ended up collaborating on, really incredible kind of public health designed architecture that would, well serve, populations. And so you're right, he died in his own hospital that Mass designed, and it was designed in a way to, how would we best put it? Kind of best serve public health needs. So the way they had airflows going through this building, and the way they had designed it, a beautiful building. I'm sure you've seen pictures of it, and the way they had the beds laid out. Everybody had a great view out of the beautiful windows, kind of thing.
Right.
And so the mantra that Paul Farmer and this architectural group were chanting was airflow, right? Public health all the way, right? Airflow, beauty, and jobs. Because they
Right.
created a heck of a lot of jobs for people building that facility. And so what I like about it is it's a kind of very, very interesting direct action, direct economic development kind of approach. You can't necessarily assume governments are going to, fill in and do anything. And so you've got to do it yourself. And I think Farmer, who was a great systems thinker, undoubtedly came to realize that it really is direct participatory development that at the end of the day is going to win out, where you just directly and positively impact people's day-to-day lives, right? In worlds where it's very hard to change the political systems,
Yeah.
that oftentimes don't help people all that much, or they're not resourced to help people. You've got to go right to the people and work your various projects. And the fact that they were able to provide people with good paying jobs and create resources that really directly impact people's lives, that's a heck of an accomplishment to see before your very eyes.
Yeah, of course. And you see, the Partners in Health is now working in 11 countries around the globe. Look at how it enormously grew over the years. And it's not easy to, he was a full-time professor in anthropology in Harvard, and also he was the head of the medical infectious disease program in Harvard Medical School.
Right.
And simultaneously, he was leading all these things around the globe. This is, I don't know how much effort he needs to do for that. And he married a person of Haitian origin. Didi
Yes,
is a Haitian, and I don't know. His life was totally dedicated to the poor section of the people around the globe. That's quite amazing, isn't it?
It is. But I will say, in having worked on a number of participatory development projects, it's incredibly motivating to see how different forms of, at the end of the day, relatively simple technology can completely change people's lives. And, I've worked on those kinds of projects in Guatemala and Morocco. And it's incredibly gratifying And so I do. I mean, my experience is just a small pinch of what Farmer must have experienced, but it's life changing.
No, no,
To
but
be
you
able
have
to
also
help
worked
folks.
around the globe. I mean, you also did so many good works. I mean, I was just thinking also about his write-ups. I mean, the prolific writer
Mm,
he was. I mean, you see, particularly he started with the infectious inequalities. Probably you have seen that the way he addressed these inequality issues with the infectious
right.
diseases and these AIDS and acquisition. I mean, what's about your take on his books? I mean, he is these 11 books that he has written so prolifically. I mean, that many of the books were text in the public school around the globe.
Right. Well, I mean, I think he became someone who we all look to for in terms of public health access and equity. And what he demonstrated is, and I think this is really key to his applied approach, is it's one thing to study inequality and lack of access, and it's altogether another thing to do something about it. And so the books are great. The books get public attention. They shine light on these incredible, you know, problems of poverty and health and human misery and all the things that go along with that. And of course, that gives him then a global stage, and it allows him to do all of his other good direct participatory development work, right? Which is incredibly expensive.
Oh yeah.
And, but it really gave him the bully pulpit and quite a platform to work off of. But you're absolutely right. The guy was a polymath, right? I mean, it seemed like he did everything. It's like,
Yeah.
oh boy.
Oh yeah.
Um, and what couldn't he do?
Yeah. I mean,
It's pretty
and this
amazing.
approach, the most important thing was his he. I mean, I was just thinking, and I was expecting that the book came from will be coming from him about COVID. I mean, he wrote on
Yeah,
HIV/AIDS and then Ebola and every
right.
disease that shake the world. And I was expecting that we'll get a book from Paul Farmer about COVID, but unfortunately he died. I mean, you see.
Yeah, well, you never know. You never know if there's a manuscript somewhere, right?
Yeah. Oh
And
yeah.
nothing would surprise me, to be honest with you. Well, if you think about again, remember he's a systems thinker, right?
Yeah.
And
Yeah. Yeah.
so, when I think of pandemics, I think of systems, and they're global systems, right? Pandemics are global diseases, right?
Right.
And of course, in this day and age, they really move around, right? With great facility and because we're in such an interconnected world. And so Farmer must have definitely been thinking about that. And of course, Africa was the last to get vaxxed, and sub-Saharan Africa particularly. And again, it just underscores the lack of access, the inequality. Certainly a number of organizations were critiquing, the rich North for not sharing vaccines with the poor South and for hoarding them and that kind of thing. And certainly Farmer would have had much to say about that, to be sure. And maybe he has.
Yeah, yeah, and you see, and look at his death. I mean, he was in Rwanda where he was trying to he made this university where
Right.
and he was working. I mean, his last day was also in in the field. I mean, working for the people. I mean,
Right.
that's resembles his I mean, he is such a person that his life can only translate it into works. I mean, you see the way he lived his life. It's like I don't see such dedication. I mean, it truly an applied anthropological way. The way he lived his life.
Well, he's a unique individual, and the fact that he must have just been shockingly smart. The fact that he found ways to leverage and support his good work in public health is, that's pretty amazing. And and this is no critique of anyone else. Most of us are just happy to have jobs, and
Right.
do what we do, and we live our lives, and hopefully do some good work. But he, clearly he dedicated his life to, the humanitarian cause. And folks like that don't come along very often. I think, if you think about anthropology, you think maybe Franz Boas and Margaret Mead and Ruth Benedict and some of those, game-changing people, right? And I think students today completely forget the impact Boas had on the world and their conceptions of race and culture and so on. And but they don't come along very often, unfortunately. And Farmer was one of them, and just
And
fell down way too early.
yeah, I thought you'll. I mean, it's dying 62 years of age is kind of. Don't you think it's a premature? I mean, it's. I mean, he has a lot to
Yes.
offer. I mean, so
But see, here's where I think he's incredibly smart. Is he didn't make it all about Paul Farmer. He institutionalized the project, right?
right.
So, he's got his NGO, which will continue to do the good work and raise the money and collaborate with great architectural design folks like Mass. And by the way, I should point out, this will crack you up, I think. So Mass has actually started to do projects in the United States as well, these very sustainable kind of public interest architectural, projects. One of them is right here in Birmingham, Alabama. And they are doing I've got to go up and see this. It just started. And of course, COVID has really goofed everything up. And so I'll send you photos of the project. They are working at a facility called Pepper Place that used to be the old Dr. Pepper drinking soda factory, which has now been turned into, boutiques and restaurants and this and that and the other thing. And, for the fancy people of Birmingham. But the other thing that's going on at Pepper Place is that it's a year-round farmers market. And what they want to do is build a pavilion for the market so that it really can operate well all year round. And they want to create community gardens, kind of urban community gardens where people can grow their own food and do so sustainably. And I thought, wow, Mass is right in our backyard. I mean, how cool is strange things happen up in Birmingham that you'd never expect.
Yeah.
And so, I mean, that's part of Farmer's legacy as well, right? You take care of people, right? And you do it in a way that empowers them and just generally creates the kind of, humane, kind society we all want to live in. I'll send you photos as this thing progresses.
Thank you. Yeah, I'd love to get that. Yeah, I'd love to get that. I mean, you see, and you see the to remain in a focus. I mean, he has been fighting for that structural inequalities in the society
Right.
for such a long period of time, and remaining to be that focus, having that focus all the way. It's not also easy. I mean, to be that focused all the way. If you see his
Right.
write-ups and works that go parallelly together, and he never missed his focus to work for the poor. I mean,
That's right.
to
That's right, which is
uh,
pretty amazing.
yeah,
Because if you look at most academics' careers, they're actually most productive when they're younger, right? And you're out
right,
doing all kinds
right,
of field work and that sort of
right.
thing. And it trails off. I
Yeah,
mean, most folks don't stay that focused, that committed, that productive,
yeah,
over the arc of their careers. And so that also sets him apart. I mean, the guy is, he was just amazing.
yeah, yeah. So about then what legacy that in being in applied anthropology around the globe. I mean, what is your what we can learn from Paul Farmer's life and work that you can just tell in brief.
Yeah, I always come back to direct participatory development and towards the common good, and whether it's medical, whether it's economic development, whatever it might be. And because that's where you can really make a difference. We can talk all we want about the complicated global politics and the strange politics of nation states and so forth, and the fragility and robustness of states, mostly fragile, right?
Right.
I think the state is kind of an interesting experiment, and we'll see how successful states really are, certainly democratic ones. And so under conditions of great global political volatility, and I think we'd all agree the world is pretty unstable and volatile, and things happen like Russians invading Ukraine that we would never have imagined a year ago. And so crazy stuff is going on out there. So in the midst of all this crazy stuff that's going on, how do you change people's lives? Direct participatory development, right? And so again, it's airflow, beauty, jobs. Wow, right? And the creation of sustainable resources that will last for a very, very long time. And so I look at that and I think, wow, that's his legacy, is creating those kinds of projects and infrastructure, creating an NGO that is institutionalized and will live on, right, doing good work, of collaborating with the darndest set of people I've ever seen in my life. And, so he had that gift of being able to sort of move across different disciplines and bring into the project, and people who have common interests and common goals and common aims to do good work. I mean, it's fascinating to me that, and yet it seems obvious that anthropologists aren't talking to architects and vice versa. Architects who are building things for human beings.
Right.
And by the way, we could say the same about engineers who build things for human beings and are themselves, last I checked, humans. And yet they see all solutions as technical and not human. It doesn't make any sense. So, I think one of the things that Farmer was telling us is that the solutions to our problems aren't technical, they're human, right? And then you just have to navigate the politics and do your thing and get on with it. And I can tell you by experience, I've worked in some places that have some incredibly fraught politics and incredibly fragile state systems with limited reach. And when they do reach, they're destructive, you can still do a lot under those circumstances through direct development. And by including communities in the process and collaborating with communities, towards the public good, everyone wins, all boats float, and you do really good work. I mean, I've seen people cry with the simplest thing. You cement a floor, right? Rammed earth floors are just public health disasters, right? You can never clean them.
Right.
Just to even cement a floor, right, will have people in tears because they understand what a game-changing technology that is for them. Let alone put in a stove that flues, all that toxic wood smoke, out of chimney or a flue. So that's where I think Farmer was really driving it, is you really have to get in and change the world right at that grassroots level.
Yeah, another important thing, what I feel is that there are some anthropologists who are like, still the lone rangers. I mean, they work in a lonely way. But look at Farmer's way. I mean, he, as you said already, that he collaborated so much and he had the access in so many places. And another important thing he did was he was also writing those stuff. I mean, we could not know this journey without his books. I mean, the way
Strong.
he was a prolific writer, and also he was a prolific speaker as well. And he never, I mean, was not that shy to
Right.
express, express his experiences around the globe. So this is writing, speaking, and working. This is such a combo. This is not easy, but I think this is the best way to, if you really want to reach globe.
Absolutely.
He's a global.
Well,
So if
and
you
and you've landed on it, Mazhar. It's let me just turn it a little bit, which is not only was he a prolific writer, but he was able to write for a broad public.
yeah,
And so, he was able to get his work out and reach a much broader public than just a bunch of academics. Academics are really good at writing stuff for one another, and then we congratulate one another about how clever we are.
right.
But nobody else reads our stuff, and they don't know what we do, and they think we're weird, and that sort of thing. But what he's doing is writing, for a broad public. So he is definitely a public intellectual, as well as a public activist, as
Yeah.
well as a medical doctor, as well as an anthropologist.
Yeah.
And that to me is the key. And in standard academia, as you well know, you don't get a lot of points for writing to the broader public, right? We get points for writing very narrow, very intellectual pieces that a small percentage of humanity can understand, let alone be interested in. And so I think he also knew that you have to write for the broader public to reach them and to, get them to understand the deep problems that we're facing in the world in terms of public health and poverty.
Little glitch. Uh, oh, um, James, are you?
Yeah.
There was the
Did it freeze
yeah.
up?
It's this is yeah. It freezed up, but
Okay.
I
Can you hear
see.
me now?
Yeah, I can hear you
Okay.
right now.
Good,
So
good, good, good.
yeah. So James, we'll conclude now. We thought that we will have a uh, we'll have a discussion on Paul Farmer's life and work. It's we can continue it for long. You see the person he was and the work he has done around the globe. We can talk hours after hours, but we I think our goal was to take some lesson from his life, that being
Absolutely.
anthropology enthusiasts. Being students and faculty who have been watching his life and reading his stuffs over the years, and all of a sudden he's no more with us. So I thought that
Right.
it would be really important to have a talk on Paul Farmer. He was such a prolific, important figure in anthropology. So, James, thank you very much for giving your time to have this little discussion on Paul Farmer. And let's have a little last word from you on Paul Farmer about his legacy. Already you
Happy
have told
to.
about that. But if you
Yes.
want to say any other last words.
Well, let me tie it up by saying what we're really doing is celebrating Paul Farmer, right? And his legacy
Right,
will live on, right? Because he's created the infrastructure for it to live on. He's brought the people together that will make it live
right.
on. And in my mind, it's an ethos that we should all embrace. We can change the world, right? It doesn't take a government to do it, right? It doesn't take
Yeah,
massive
right.
institutions to do it. And he's shown us the way. And to me, it's incredibly motivating and inspiring I would also just like to do one quick shout out for the Society for Applied Anthropology. And if those of you out there don't know, Mazhar was on the program committee that worked with me. I was a program chair for the latest meeting in Salt Lake City, Utah. And Mazhar helped out as a program committee member. I can't thank you enough, Mazhar, for doing that with us. And for those of you interested, we want to increase our international outreach. We are working on ways to do that. There is now a group within the Society for Applied Anthropology called SFAA Global. And we really want to reach out and collaborate and work with as broad an international group as we can, because I think we're all brothers and sisters in arms.
All right. So thank you, James McDonald. Once again, I mean, you have been a very good friend of Institute of Applied Anthropology and Anthropublic here from Bangladesh, and many of you know your works and you personally. So it's really a privilege to have you once again. So I wish you all the very best and good health and you know, in a best day in the world, and let's celebrate post farmer life and work
Absolutely.
in many ways during our rest of our life.
Indeed, indeed. Well, thank you so much for the invitation. And I love what you're doing and how we're reaching out and connecting with one another. And let's keep these great collaborations going.
Thank you. Thank you, James. I will see you then again. Thank you very much.
Take care.
You too. Thank you.
Bye-bye.
Bye.